a series of different interventions to help you sleep. First thing you do, patient comes in, says, I can't sleep. I was like, let's hit the low-hanging fruit. Behavioral changes are first. So, are you exercising in the morning? Are you getting sunlight? Have you stopped coffee 8 hours before bedtime? Have you stopped exercising 2 to 3 hours before bedtime? No meals 2 to 3 hours before bedtime? Avoiding tobacco and alcohol products before bedtime? Pretty much you need on the alcohol, for every ounce, you need 4 hours. Caffeine, 8 to 10 hours. Tobacco, at least 2 hours. So that's the low-hanging fruit. Don't drink a lot of water. Don't engage in emotionally charged interactions on texts, emails, social media, conversations with family members in your home or roommates before bed. Next thing you do, homeopathic remedies. You can't sleep. You've tried the behavioral changes. They help. The other medicines are not going to work if you don't do the behavioral changes first. Next, I tell everyone magnesium. There's a magnesium breakthrough product. It's made by Biooptimizers. It has all the different types of magnesium. Magnesium glycinate, bisglycinate, magnesium malate, oxalate, taurate, glycinate. So it's a mixture of them all, L-threonate, and you take one at bedtime. So that's low-hanging fruit. Make sure your bed is dark, cool, comfortable with pillows and blankets, whatever you like, and quiet. You have to have a good sleeping environment. So if you try all that, try the magnesium? No. Then add L-theanine, which is green tea extract. Try 800, 1600 milligrams. That should work. That's about half of all people right there. If that doesn't work, then what do? You go and add Apigen, 400 to 800 milligrams. That's another homeopathic remedy. And we stack magnesium, L-theanine, Apigen, behavioral changes. If that doesn't work, Aconitin napellus, 5 pellets. It comes in these little cylinders, and you turn it, you buy it, you can buy it on Amazon. Okay, now we've exhausted all the interventions homeopathically, behaviorally, vitamin-wise. There's some other stuff out there, but I'm not putting it in this talk because it doesn't work, like hibiscus tea, chamomile tea, valerian root, rhodiola, blah, blah, blah. It doesn't work. Next, people talk to me about melatonin. Melatonin can work 2 to 5 milligrams. I'm not a fan of it. It's an endocrine hormone. I'm iffy on it. There are drugs which are similar to melatonin in how they act on the melatonin receptor. Ramelton, or Heltios, Tasmelton. I don't know, they're expensive. I don't know, if you're going to go the melatonin route, just take melatonin. The melatonin agonists or stimulating receptor drugs like Rosaram and Heltios, they're not worth it in terms of cost. They work. I would say the most effective compounds at this point would be Ambien, Zolpidem, Isopiclone, Lunesta, Zalpan, Sonata. Of those, I use Ambien, 5 in women, 10 in men. It's a little weird. People wake up a little irritable. It can cause complex behaviors like talking, texting, bizarre things, making phone calls when you're out of it. If you fight the drug, you'll get into trouble. Lunesta, Isopiclone, can cause metal taste in your mouth. People find it very uncomfortable. And Sonata doesn't keep you asleep. The next class of drugs, which are part of stacking, are the Orexin drugs. And these drugs stop you from being awake. It's not that they put you to sleep. They affect orexin and they block it, and that keeps you awake. Belsomra, Suvorexan, Dayvigo, Lemborexan, and Quivic, which is daridorexant. So they're good drugs. I don't find they work alone. The Z-drugs, Ambien, Lunesta, and Sonata, do work alone. After we've stacked with behavioral changes, magnesium, the L-theanine, the Apigen, and the Aconitinapolis. The next class of drugs, I would say, under no circumstances would you use. Those would be triazolam, temazepam, eptizolam, florazepam, quazepam. Some people use lorazepam and alprazolam. They go by names like Halcyon, Dalmane, Restoril, Prosom, Klonopin, Ativan, Xanax. These are absolutely, don't use them. Skip over this part. Just blank that out. Anything in an AM, a benzodiazepine, why? Tolerance develops. Same amount of drug stops working. No matter what, it stops working within about 2 weeks. Interdose anxiety, you take it, the next morning you're a little anxious because you're in withdrawal from it. It's habit forming. There's a withdrawal phenomenon with it. It interacts with alcohol. I am not a fan of these drugs. Zero, none, zip, don't use it. The final class, which I use a lot, the antidepressants, which work for sleep. Trazodone, which is Desiril, works great. It's pretty safe. You need a script, 50 milligrams, puts people to sleep, minimal side effects. There's something called Doxepin, which is Sinequan or Silnor. Low doses, 25, 50 milligrams, puts people out. I don't like using that one. Dry mouth, blurred vision, constipation, not a fan. Mirtazapine, which is Remeron, can be used for sleep, but puts on weight. Works great though. Lower the dose, the better. The higher the dose, it actually causes insomnia. Not a fan because it puts on weight. Some people need to gain weight, can use it. The next would be the antipsychotics for sleep. And in this class, the key, I would say one of the most powerful drugs for sleep would be 50 to 100 milligrams of quetiapine, which is Seroquel. I don't like using it. It has a lot of side effects. I'm not even going to get into them. But this is for someone in acute withdrawal who's desperate, someone who's psychotic, someone who has got agitated depression. It's an extreme drug for an extreme case of insomnia. So this is just what I ran people through, knowing I use the least invasive intervention first, and then I move towards more invasion, and that's how I geared the talk. Dr. Mark Agresti. I have a blog, drmarkagresti.com. I may have posted 100 articles in the past 3 months. Thank you.